I think the biggest myth that's out there is that 30 is like a ticker bomb for us. How much of it is true?
So what we should understand that any pregnancy before 30 is always better. So the health of the pregnancy, the easy to conception, it is always better before 30. But once you cross 30, the quality, the egg number would decline. But it doesn't mean that it is impossible to conceive. So all the girls out there, relax. What you have to do is you just go to the doctor, get your egg count checked.
Culturally, there is a need or there is this thing that you want to have a boy. Of course, we all know that this might not work, but what does the science support? What does it truly takes to have a boy or a girl?
Everyone should understand that there is no type, there is no position of sex, there is no XYZ factor which can determine the gender of the baby. It is basically which chromosome fertilizes the female egg that decides whether we are going to have a boy or a girl child. So please stay away from any advice, any Chinese calendar methods, or any kind of diet which will decide the gender of the baby.
Hi all, welcome to our podcast by Motherhood Hospital, Kharadi, Pune. Today we have with us Dr. Preethika Shetty, who has more than 17 years of experience in obstetrics and gynecology. She's going to talk to us about a lot of fertility myths that are around social media. Recently, we have seen that more than 200% increase in people Googling about fertility in Maharashtra itself. And a lot of times we have seen people, there are so many reels on the internet which are talking about eat this to improve egg quality, do this to have better fertility results, which are a lot of times misleading as well. So today we at Motherhood Hospital decided to go ahead and understand what are the myths, what are the facts, and we are going to debunk the myths for you with Dr. Preethika Shetty. Thank you so much, ma'am, for having the time to be here with us. Thank you so much for being here.
Thank you for inviting me here. Thank you for a beautiful introduction. It's my pleasure to be here. Let's discuss a lot about the fertility myths and facts to help all our viewers.
Thank you so much, ma'am. So, Dr. Preethika, I think the biggest myth that's out there is that 30 is like a ticker bomb for us. तो हम सारे इस समय अपने careers में हैं, we are busy. Any which ways conception age has been delayed a little in the common public as well. But we have this timeline of 30. That 30 के बाद तो it's going to be very difficult to get pregnant. You will need fertility treatment, so you should rush towards it. How much of it is true?
Yes, it's a very common myth what we hear in the working girls. They come with anxiety to us that we're not able to plan at 30 or we are getting late to plan for the pregnancy. What shall we do, doctor? That is the common question. So what we should understand that any pregnancy before 30 is always better. So the health of the pregnancy, the easy to conception, it is always better before 30. But once you cross 30, the quality, the egg number would decline. But it doesn't mean that it is impossible to conceive. So all the girls out there, relax. What you have to do is you just go to the doctor, get your egg count checked. So you would know where do you fall. Is there a really difficulty in conceiving or your egg count is good? So you would know what is your what we call it as AMH. There is a test called as AMH. You get it done, so you would know where do you stand. So nothing to worry as such. Definitely, as the age advances, the chances of conception would reduce. The quality of pregnancy might get hampered. I won't deny.
Amazing. So, Dr. Preethika, I'm seeing a lot of reels saying that you should eat pineapple to conceive. And there was a friend of mine who was actually eating a lot of pineapples and Brazil nuts just so that she could conceive at a certain point in time. How true is that?
Yes, so pineapple has become a hero during the time of conception and it's a villain during the pregnancy. So there's a lot of debate on that. Honestly, as per the medical science, there is no proven evidence that whether pineapple is too helpful or too bad during pregnancy. Definitely, pineapple has a lot of anti-inflammatory effect. It will aid whenever couple want to try for pregnancy. But if pineapple was the only solution, it would have been easy for everyone.
I totally agree. All right, amazing. So, Dr. Preethika, we are also hearing a lot of buzz around IVF, that it's only for people who can afford it, it's not needed for every couple. And then a lot of times we are also hearing and seeing this that just because you want it fast, you want it sooner, that's also IVF is being used. So, what's your take on IVF? Is it a very expensive procedure? What is it?
Okay. So first of all of us should understand that fertility treatment doesn't mean it is always IVF. There are multiple modalities of treatments even before the IVF, which are not so expensive, which are easy for the body to take, less time consuming. So any couple who are having fertility issue, do not get scared to step into a IVF center. There are multiple other options as well. So in a case, if a couple have to go for IVF due to whatever reason, if there are no other treatment helpful for them, I agree to the fact that IVF is expensive, but there are insurance companies who are helping out to that. But I would say that that is worth spending some amount on that treatment than delaying the pregnancy with the fear of the expenses or other medical issues related to IVF.
डॉक्टर प्रीतिका हम ये भी सुन रहे हैं they are also listening to this that it's just stress because in my case itself I mean I don't know whether it was stress or not but my doctor we were to a point wherein the doctor said that IVF is the only option. I actually went on a trip and came back pregnant. I don't know whether it was really stress or not, but a lot of times I've been listening to this that don't stress, you'll conceive, don't stress, you'll conceive. But does it really work like that?
So facts about the stress and conception is definitely stress will lead to some amount of hormonal disturbances which might affect the egg quality or the sperm quality or the conception rate could get reduced with that. But a day-to-day routine stress is there for each and every person. So that shouldn't be the only factor to hamper the fertility or the conception rate. So whenever you are finding any difficulty to conceive, go to the doctor. Check for the other factors if they are leading to any cause of infertility. If everything seems okay, then definitely we should work on our stress management, exercises, meditation, breathing techniques, sorting out things in life would help to conceive.
Amazing. Dr. Pritika, we have come a long way as a country. You would agree on it, I would agree on it, in terms of medical science also. But culturally, there is, I mean, you are a woman, I'm a woman, but culturally, there is a need or there is this thing that, you want to have a boy. And based on that, there are a lot of myths around or a lot of advices around new couples that, if you're trying to conceive, you do it on a certain day, on a certain time, with a certain food, you might conceive a boy or you might conceive a girl. Of course, we all know that this might not work, but what does the science support? What does it truly takes to have a boy or a girl?
I think, Parul, this is one of the very important question you've got today in the today's discussion. Everyone should understand that there is no diet, there is no position of sex, there is no XYZ factor which can determine the gender of the baby. It is basically whether which chromosome fertilizes the female egg that decides whether we are going to have a boy or a girl child. So please stay away from any advice, any Chinese calendar methods or any kind of diet which will decide the gender of the baby. I personally feel with all my career of 17 years, every couple should be grateful if they are blessed with a healthy baby, irrespective of the gender of the baby.
That's beautiful, and I totally agree with that. And also, that being said, that a chromosome would actually fertilize the egg, and that's what would lead to a boy or girl. I also want you to shed some light on the fact that it's the male chromosome that decides, because a lot of times women who are having a third girl child, they are being told that you are not able to give birth to a boy. So we need to probably emphasize on this as well, that where is this genetic thing coming from? I mean, who is choosing the gender?
Absolutely, absolutely. Every woman should understand that it is on the male sperm which sperm is going to fertilize the female eggs. The onus is not on the girl, neither on the man. It is on the sperms whom nobody can blame on that. So neither girl take the blame on you, or not the male, or the family member should take a difficult path for the girl to choose a boy baby or female baby whatsoever.
So it's a blessing. We should all just simply receive it and be grateful for the same.
Exactly.
Dr. Preethika, another myth about fertility is that fertility test should be done once you've tried for almost a year. So if I am 32, 35, should I still wait for a year? Or if I have PCOS, PCOD, I mean, how does it work? Should we actually wait for a year before seeing a doctor? Or can we do it earlier as well?
Also, like couple of years back when we were doing our studies, in the textbook it was mentioned that we can wait for 1 year before any couple undergo any kind of investigations related to fertility. But this era, we are emphasizing more on the preconceptional test, preconceptional fertility test, so that the couple are well aware about their fertility capacity, they're well aware about their medical situation, so that the pregnancy can be easy and healthier. So any couple, like any girl who is more than 35 years, better she gets her fertility checks done very early. Or if you already know that you are having a PCOS or fibroid or endometriosis, please get the checkups done. There's no need to wait for 6 months or 1 year to get the any kind of related investigations.
Amazing. So I am somebody who has battled endometriosis. I'm still battling endometriosis, which has been a very difficult journey. So yes, it does affect fertility. But just a question out of curiosity: do you think that endometriosis would always lead to infertility, or it would lead to fertility as well? I mean, does it always play a role, or it could just not be any effect on the pregnancy?
Yes. So there are multiple stages of endometriosis. Generally, stage 1, stage 2, and if the girl's egg reserve is good, it may not even lead to fertility issues. Most of the times, we get to know that the patient is having endometriosis with the first scan during pregnancy or at the time of cesarean delivery. So, not that every endometriosis will lead to fertility. So, any girls with PCOD or endometriosis or fibroid, do not worry that you won't conceive. Go consult the gynecologist, get a detailed test done, then you would know where is your position about the fertility.
Amazing. Another question comes to my mind that today I am somebody who is just taking an IVF treatment or probably a fertility treatment. It also takes on my mental load or my emotional health. Now, one when the time of delivery comes, does a fertility treatment 110% leads to having a C-section, or is there a scope of me having a vaginal birth as well, even if I've taken a fertility treatment like an IVF or any other IUI cycles, etc.?
Exactly. So generally, the mode of delivery does not depend upon what kind of treatment you have taken to conceive, but invariably, a couple who has taken a fertility treatment would have a twin gestation, or because of the age factor, they would have gestational diabetes, or they would have high blood pressure, or it could be suspicious pregnancy in one or the other way. Then there could be chances that their consulting gynaec might advise a C-section to safeguard the mother and child. But it is not equal that if it is an IVF pregnancy, there has to be C-section or vice versa.
Thank you so much. So, Dr. Preethika, before I let you go, I also have a very important question. Do you have any tips which are scientifically backed, medically proven, to help our viewers conceive easily?
Yes. So I would say that lifestyle is the first and foremost important thing, wherein the couple should focus on the healthy diet. Regular exercise is the second point. Stress management, keeping the work and life balance is important. Sleep plays a major role on the sex hormones or the reproductive hormones. Then getting your regular checkups done, not hesitating to go to a gynecologic visit whenever you feel there is any abnormalities in your period cycle, or if you're tried for a couple of months, if you're not able to conceive, just don't wait, go to the doctor, get yourself checked. By chance your doctor advises any test or basic treatment options, you can start with those treatment without any hesitation.
Amazing. Thank you so much, Dr. Preethika, for being here with us today, and thank you so much for handling all these amazing myths. I mean, I'm also a part of like what one time pineapple is bad and the other time pineapple is good. How can it be so? But thank you so much for being here. Thank you so much for valuable insights, and thank you for all the viewers who listening to us. The link to Motherhood One app is down below. If you can just click on the description and download the app, we all are here to support you and help you out. Thank you so much for reaching out and listening to us. So I also have a very good news for our viewers that we at Motherhood Hospital, we are coming up with Motherhood One app. Now that's your premium pregnancy care club. Here you will have all the support that you need for fertility, pregnancy and conception. So I think you're also there on the app and you would also be there supporting us, right?
Yeah, I agree to that. So viewers, instead of relying on any social media reels and information from any unknown sources, it is better that you join in the Motherhood One app, wherein all the consultants or gynecologists will give you a lot of details. Definitely, information would help you to conceive and for the further pregnancy care.